the assistance of an injured diver, it's important to take a moment to remember to save yourself first. Save is a reminder to stop. Take a moment to think and then act. You'll need to locate your DAN oxygen unit and personal protective barriers such as latex gloves. Assess the scene. Before assisting another person, is the scene safe? Review the environment. Is the diving equipment secure? Have the divers been recalled? Are there any other hazards present? Is there adequate ventilation for the use of oxygen? Make sure that all smoking materials are extinguished and that oils, grease, and other contamination is avoided. Use exposure protection such as gloves and mouth-to-mask barrier devices. Avoid contact with blood and other bodily fluids. After making sure that the scene is safe for both you and the use of oxygen, you'll need to assure and maintain the airway, breathing, and circulation, also known as the ABCs, for the injured diver. It's recommended that you have training in cardiopulmonary resuscitation prior to entering the DAN Oxygen Provider course. The steps in assuring the ABCs are easy to learn, but frequent practice is necessary to maintain your comfort and proficiency with this skill. Variations in protocol and techniques may vary from country to country. Your DAN oxygen instructor will review these techniques with you. CPR is generally not taught as a part of the DAN Oxygen Provider course. However, your instructor may teach CPR as a module in conjunction with this program. Once the airway, breathing, and circulation are assured, you want to provide the highest concentration of oxygen possible to an injured diver. With the DAN oxygen unit, the choice of which oxygen delivery device to use is simple. If the injured diver is breathing, then your best choice is the demand inhalator valve with oronasal mask. If for some reason the breathing injured diver can't activate the demand valve or won't tolerate its use, or if you have two breathing injured divers, you can use the non-rebreather mask to provide high concentrations of oxygen. If the injured diver is not breathing, use the pocket mask with supplemental oxygen when performing ventilations or CPR. Most diving injuries are not serious. The injured diver will often have mild symptoms and may even deny that they're injured. Once you've recognized a sign or the diver reports an injury, provide oxygen. The demand inhalator valve is the first choice anytime there's a breathing injured diver. The steps to providing oxygen using the demand inhalator valve are similar to using a scuba system. Once you've assessed scene and provider safety and checked the ABCs, inform the injured diver that oxygen may help. State, "This is oxygen and it may make you feel better. May I help you?" If the injured diver is unresponsive, permission to help is assumed. Next, deploy the oxygen unit. Open the cylinder valve with one complete turn and check cylinder pressure. When activating the system, avoid looking at the pressure gauge. Be sure the system is not leaking, and then take a breath from the demand inhalator valve. Exhale away from the mask to reduce the risk of disease transmission. Place the mask over the injured diver's mouth and nose and instruct the diver to breathe normally and remind them that the oxygen unit is similar to a scuba system. Comfort and reassure the injured diver and listen for the activation of the demand valve. Observe the mask fogging during breathing and watch the chest rise and fall. This way you're monitoring the ABCs. Positioning is also important when assisting an injured diver. If the diver is responsive, you may place them either on their back or in the recovery position, on the side with the head supported. If the injured diver is unresponsive but is breathing, they should be placed in the recovery position. The recovery position minimizes the risk of airway obstruction, and if vomiting occurs due to near drowning or for some other reason, gravity will help keep the airway clear. If the injured diver is not breathing, they should be placed in the supine position on their back for ventilations or CPR. Once the diver is properly positioned, activate your emergency action plan by calling the emergency medical services or other local protocol and ensure the diver gets evaluated at the nearest available medical facility. Call Dan if you're not sure what to do or if further consultation and advice is needed. Remember, at no time should oxygen first aid be used in lieu of evaluation and definitive care by a trained medical professional. You may provide water or other non-carbonated, non-caffeinated, non-alcoholic beverages, if tolerated, to divers who are responsive while waiting for other assistance. If the breathing-injured diver can't activate or tolerate the demand inhalator valve, you should use the non-rebreather mask. Stretch the oxygen tubing to avoid kinks and attach it to the barbed constant flow outlet on the multifunction regulator. Set the constant flow control to 15 liters per minute. Prime the reservoir bag on the non-rebreather mask by putting a finger inside the nosepiece and sealing the non-return valve until the bag fully inflates. Place the mask on the injured diver's face and adjust the elastic band around the head to hold the mask in place. Squeeze the metal clip over the nose and check to make sure there are no leaks around the sides of the mask. If there are leaks, you may need to gently hold the mask in place to improve the seal. Instruct the diver to breathe normally and watch for signs of breathing. Assure that the reservoir bag remains inflated. If not, increase the constant flow rate from 15 liters per minute to 25 liters per minute. If the injured diver continues to completely deflate the reservoir bag, encourage them to switch over to the demand inhalator valve. Place the injured diver in the proper position and comfort them. Then activate your emergency action plan and call Dan. In order to increase the chance of a successful outcome, provide supplemental oxygen during your resuscitation efforts if oxygen is available. Either you or a bystander should secure and deploy the oxygen unit. Remove the oxygen tubing from the non-rebreather mask and attach the tubing to the regulator and then to the pocket mask. Set the constant flow control to 15 liters per minute and listen for the flow of oxygen. Make sure that you have an adequate seal with the mask on the face and that you can watch the chest rise and fall. Resuscitation efforts should not be delayed while securing the oxygen unit. If the injured diver spontaneously begins breathing, leave the pocket mask in place until breathing is well established. Assess the ABCs and place the injured diver in the proper position. Then switch over to the demand inhalator valve or non-rebreather mask. Another situation you may encounter is having to provide oxygen first aid to 2 injured divers at the same time. Your first course of action is to determine which diver has the most serious signs and symptoms and provide them with the highest concentration of oxygen possible. If they're breathing, you'll use the demand inhalator valve, and if they're not breathing, use the pocket mask with supplemental oxygen. On the second injured diver, deploy the non-rebreather mask if they're breathing. Remember to provide the highest concentration of oxygen to the diver with the most serious condition. As a Dan oxygen provider, take a moment and review the scenario. Determine your best course of action, and remember that your best rescue efforts based on your training and experience is all that's expected. How you store your oxygen equipment is important so that it's ready to use in an emergency. Assembly and disassembly of the oxygen equipment is also important, so you'll be able to clean the unit and be comfortable and confident in its use. Dan recommends the Dan oxygen unit be left assembled and depressurized inside its waterproof case. First, make sure the cylinder is turned off and the unit is depressurized. Remove the multifunction regulator from the cylinder valve and note the system by which the valve and regulator attach. If your system leaks, check the oxygen washer to be sure that it's free of debris and other scarring that might cause it to not seal properly. Note that the washer is different than a scuba system O-ring. Note that check valves on the multifunction regulator prevent oxygen from flowing out of the outlet ports when hoses are not attached. Gently rock the mask back and forth to remove. Unscrew the plastic mask adapter from the demand inhalator valve and remove the exhalation valve assembly. You should clean and disinfect the plastic mask adapter, the exhalation valve assembly, and the oronasal and pocket mask after each use. One method is to soak these parts in a mild bleach solution, rinse with fresh water, and allow to thoroughly dry. Other sterilizing agents are available. Ask your instructor for cleaning recommendations. Once the parts are clean and dry, you should assemble your Dan oxygen unit and store it for another day. Place the exhalation valve assembly inside the demand inhalator valve. Attach the plastic mask adapter on the demand inhalator valve. To avoid cross-threading the adapter and valve, first screw the plastic adapter into counterclockwise direction until you feel the adapter find the groove of the valve. Then turn in a clockwise direction. Gently rock the mask back and forth until sealed. Place the oxygen washer on the regulator inlet and connect the regulator to the cylinder. Check to make sure the system is functioning by pressurizing it and listen for leaks. If there are no leaks, turn off the cylinder, depressurize the system, and store the unit. If the oxygen unit has been used, refill your oxygen cylinder prior to your next dive outing. Practice these skills with your Dan oxygen instructor so that you'll gain confidence and experience in providing oxygen first aid to simulated injured divers. While diving injuries are rare, it's important to understand how to assist a fellow diver in a time of need. The injured diver who may need help could be you. This course does not cover comprehensive dive accident management and scuba rescue. The skills learned during these programs will further improve your confidence in assisting injured divers. Having viewed this videotape, you should know the importance oxygen plays for the anatomy and physiology of the human body, and how the respiratory and circulatory system work together to provide the body with oxygen and remove waste products. You should know the various mechanisms of scuba diving injuries and some common signs and symptoms. You have reviewed the hazards of breathing and handling oxygen and should better understand the risks of oxygen use. Oxygen equipment and the types recommended for use were reviewed, as were the benefits oxygen provides for a diving injury. Techniques for providing oxygen to injured divers were covered, so you'll be prepared to provide oxygen first aid to injured divers in the unlikely event you or your buddy are hurt while diving. But taking the Dan Oxygen Provider course is not enough. It's also important to be prepared in the event of a diving accident or injury. Join Dan so that you'll have access to Dan member benefits such as possible evacuation for medical and diving injuries. Plus, as a Dan member, you'll also be kept up to date through Alert Diver, Dan's membership magazine, on important topics concerning diving safety and health. While much has been covered about scuba diving injuries and their appropriate treatment, if you have any further questions, call Dan's Diving Medical and Safety Information Line. Dan is working hard through diving medical research to find out why divers get injured. All of the services Dan provides to the diving community could not exist without your support. Join Dan today. We are your Dive Safety Association.